I am Dr. Shrikant Dalwaldi. I am one of the surgeons in the team of I&U, and I am a cataract, glaucoma, and LASIK surgeon. You are watching Tililindo program on CAST TV.
Welcome back to Tililindo program, where today we are focusing on eye health with a special guest, Dr. Shrikant Dalwaldi, an experienced ophthalmologist at I&U Hospital. There are many misconceptions about eye health, from eating carrots will fix your eyesight to wearing glasses makes your vision worse. But how much of this is actually true? Dr. Dalwaldi helps us separate fact from fiction.
Carrot has a lot of vitamin A. It actually provides nutrients to retina, but it does not improve the eyesight. Okay, nutrients to retina can always preserve your sight, but the the refractive, the numbers which a person has, if we are confusing carrots to help in reducing the numbers or something like that, it does not happen. It does not happen because the numbers are more related to the shape and the size of the eye. Reading in dim light always causes some strain to the eye. It does not damage the eyesight, but it causes a lot of strain, and ultimately the eye gets fatigued and you have to rest. No. The exercise does not help to correct the vision. It helps in some other condition like restoring the muscle balance when the patient has squint or some phobias, as we call it technical. But there are exercise for certain condition, but for the these things it does not help. Biggest mistake, because as I said earlier, most of the eye conditions are not painful. So people tend to overlook this. They do not understand the gravity of the situation. If your eye is red for a day or two, rather than doing something on your own, visit an ophthalmologist, because the redness of the eye can be related to lot many conditions. Some may be very normal like allergy, which can be treated or which can go away in few days, but some can be related to some other conditions. So redness per se is not for the same reason. The redness can be due to any other condition in the eye which can be affecting your eye in a big way. So unless you go to an ophthalmologist for your routine issues, which you may find not so significant, I think there are a lot many things which can be prevented. Normally shades are enough. The UV blocking glasses are enough. Normally sunlight, the UV rays in the sunlight, they are known to cause early cataracts, pterygiums. There are a few other conditions in the eye which are related to sunlight. The allergic patients are not comfortable going in the sunlight. They feel a lot of light, photophobia, intolerance to the light. So in all these conditions, rather than for protecting the eye, one always should wear some of the glasses which are UV blocking, or maybe shades in the sunlight to prevent these issues.
Technology in eye care is evolving rapidly, offering new hope for people with vision problems, from implantable corneal lenses to cutting edge treatments. Dr. Dalwaldi takes us through some of the latest advancements in ophthalmology.
My specialty is LASIK. LASIK is a laser vision correcting procedure. So LASIK is the name of the machine that we have over here. It's Allegretto 500, one of the most advanced laser machine in the world, one of the very fastest, very accurate. It's a very advanced technology. A person mostly below 40 years of age, in some instances above 40 years also, if anytime he does not want to wear glasses, he want to get rid of the glasses, then we can perform a surgery which is known as LASIK. Now, LASIK surgery is a very quick, very fast, very accurate, and one of the most, I can say, one of the most accurate procedures, any surgical procedures which are done on our body. LASIK is one of the most accurate procedure. It's like it takes like 15 to 20 minutes for both the eyes, and the patient eventually gets rid of the glasses, and he is spectacle free for life. There are some criteria for the LASIK surgery, like the power which the patient has in his spectacles, If the corneal thickness is not adequate, then we suggest some other procedures. We have stringent criteria of analyzing the patient before the surgery over here to check whether the patient is qualifying for the for the LASIK surgery or not. If not, then we do not advise the procedure. For the patients who have some high numbers or error, as we call refractive errors, or maybe the he is not qualifying for the LASIK procedure, we have something known as some other refractive procedures known as implantable Collamer lenses, which are very thin contact lenses which are placed in the eye on the natural lens, and which reduces the power or maybe neutralizes the number, and patient can see without glasses. Implantable Collamer lens, ICL, it is an implantable Collamer lens. It is a very special lens made up of special material, and that's the lens which we advise for the patients having very high numbers and which are not treatable even by LASIK, because in LASIK, when we do the surgery, we actually sculpt the cornea, we reshape, resize the cornea, and there is a certain permissible limit till which we can do it. So in case of the patients who do not qualify for the LASIK, like patient having a huge error like -13, -14, or maybe the corneas are thin, with high astigmatism with cross numbers, then we advise them for implantable Collamer lens. That's the lens which is implanted in the eye on the natural lens, so it neutralizes the power and the patient can have vision without their glasses. And whenever later in the life, when they have cataract developed, then this lens can be removed, the cataract lens also can be removed, and then we can implant another lens to restore the vision. So this is something very recent and very helpful technology or device for the patient having high myopia or high astigmatism. If this is not permitting, then we go for a refractive lens exchange, whereby we remove the clear lens and we implant another lens in the eye, which can make him see the things without glasses for his entire life. There is another class of patients who are presbyopic, like above 40 years of age. It's the age when patient or person gets readers. They need reading glasses. Now that is because of the weakness of the ciliary muscles, which are the intrinsic muscles of the eye, which are responsible for the focusing of the lens. These muscles gets weak with the age, and you have to supplement the power with help of some plus lenses to read. There are many patients who are not happy with wearing the glasses. So we have an option for them also. There are modern age presbyopia correcting intraocular lenses available, which are like bifocal, trifocal, or extended depth of focus lenses, which we can implant in the eye after removing their normal lenses. The advantage of this procedure is that they get rid of the glasses for near, intermediate, distance, and there is no cataract in the future. So they are done for their life. They don't have to do any other procedure in the eye later on in their life. So that's all the specialty I talked about: cataract, glaucoma, LASIK, and refractive surgeries. That's my specialty.
Finally, if you need professional eye care, where should you go? Let's learn about the specialized services offered at Eye and You Hospital.
We basically are a team of 4 surgeons from India who performs surgeries over here. I am Dr. Shrikant Dalwaldi. As I told you, my specialty is cataract, LASIK, and glaucoma. There's another surgeon who is Kaushik Solanki. He also does cataract, glaucoma, LASIK, and corneal surgeries. One more surgeon, Dr. Amit Patel. He is a cataract surgeon along with glaucoma and LASIK surgeries. And we have a retina specialist with us, Dr. Shailin Parikh, who takes care of the retinal issues in the patients. So you can expect to get treatment for any of your eye conditions over here, which is we are well equipped. We are supported by latest diagnostic equipments with us, like we can say oculizer, topolizer, which are essential to measure the curvatures and the integrity of the cornea before doing a LASIK surgery. which are very advanced machines that we have. We have ocular coherence OCT, ocular coherence tomography, which is a scan of the eye, which is used to measure the intrinsic retinal problem, which cannot be seen with the on a direct examination, which is in the layer of the retina. We can measure that. We can measure the optic nerve with that for glaucoma progression, as I said before. We have visual field analyzer over here to measure the visual field and check the progression of the glaucoma, and some other neurological conditions also can be diagnosed using that. We have YAG laser to treat the opacification after the cataract surgery. Not after cataract or the posterior capsular opacification, we do with the YAG laser. The YAG laser can also be used to treat glaucoma. In some cases of glaucoma, we do YAG lasers. We have green lasers with us to treat the diabetic retinopathy and other vascular diseases of the retina and some glaucoma patients. Even with that, we have fundus camera to take the photograph of the retina and optic disc, and just to check the progress of the disease over a period of time. We have latest surgical equipments like Constellation, which is a two-in-one machine. We do phacoemulsification with that. It's used to treat the retina patient during vitrectomy and other complex procedures with that. We have a hair and microscope, which is one of the latest microscope from Zeiss, which is German make. We have LASIK machines, as I told you, Allegretto 500, which is one of the latest machine. It's a very fast laser. We have other routine diagnostic equipments like autorefractometer, lensometer. We have keratometer. We have tonometer, applanation tonometer. We have non-contact tonometers to measure the pressure of the eye. We have full-fledged, we have two optometrists with us who takes care of the patient for the primary evaluation. We have ancillaries with us who guides the patient all the time. We have a full-time counselor who counsels the patient and advise them about their conditions and what surgeries they are required, and in details. We have a good patient launch for preoperative waiting. We have 3 operation theaters. So in all, we are very well equipped to take care of any of the conditions of your eye. I should feel confident coming here, and you will be guided in a perfect way, and whatever right will be done for your eye.
With all these insights, what is the one thing our expert wants us to take away from this conversation? Let's hear his final advice for protecting our vision.
My final message to all the viewers will be, just don't take the eye conditions, if at all you have any, in a light way. Just get proper guidance for whatever the condition. There are some conditions which can be prevented from progressing further, and sight is very important gift of nature to us. 70% of sensations are through the eyes. If there are no eyes, then I think we are losing that part of our world. And I think everybody understands significance of the eye. So my only final word will be, just be proactive for any of your even minor conditions, and we may happen to diagnose something which is essential to treat and can preserve your vision for your life. The child went to be taken for examination. The young patients went to be taken for examination. After 40 years of it, there are some certain conditions which develop with the age. Diabetic patients, myopic patients, astigmatism. So if you have some conditions, otherwise also it's good to get your eye evaluated just like that, because there are many conditions which a person may not be aware of. And if there are some family issues like some having glaucoma, some having diabetes, then I have to get your eyes checked. Even if you don't have those conditions as such, you may have that.
And with that, we come to the end of today's episode.
Thank you.
Okay, bye. We hope you've gained valuable knowledge about eye health and why regular checkups are so important. A huge thank you to Dr. Shrikant Dalwaldi and his team from I&U Hospital for sharing their expertise with us. Until next time, take care and keep your vision healthy. My name is Chemtai Kirui, reporting for Tililindo program on CAS TV.